Here are 20 osteosarcomas in about 10 minutes. I'm not going to go through all the facts of osteosarcomas, but rather the attempt is to imprint what it looks like radiographically, so when you see one, you think of osteosarcoma. First, I'm going to ask that you close your eyes and picture an osteosarcoma in any location. What does it look like radiographically? If this is what you came up with, you are on the right track. There is an aggressive lesion in the distal femur with a lot of sclerosis, and that is because osteosarcomas produce bone. Let's try it one more time. Close your eyes and picture a different appearance of an osteosarcoma. If you can't do that, then stay tuned. Osteosarcomas occur in younger individuals, although there is a second, smaller peak. While they're overall rare, they're the most common childhood bone malignancy. Where do they occur? Actively growing areas. They can appear sclerotic. They can appear lytic. But usually, they are a mixed appearing lesion. I will sneak in a few facts before we look at all the images. Osteosarcomas appear aggressive with a wide zone of transition, cortical erosion, and a soft tissue mass. They tend to have non-expansile cortical destruction. Periosteal reaction can occur in a perpendicular orientation, a parallel or onion skin orientation, or in a divergent or sunburst, very aggressive appearing orientation. The Codman Triangle is another type of periosteal reaction where the advancing tumor interrupts the periosteum, resulting in this triangle appearance. While there are different types and subtypes, we're going to concentrate on the overall appearance of osteosarcomas. Getting started with case number 1. Here the lesion is aggressive appearing with a lot of bony sclerosis, extending to but not crossing the growth plate. You'll see that in osteosarcomas. In this case, we also have a pathologic fracture, something to always look for when you see a bone tumor, and the opposite, when you see a fracture, always consider an underlying pathologic lesion. Here it looks more well defined along that lateral aspect, and that is often seen after chemotherapy treatment. There's the post-operative image. Case number 2. 24-year-old, less obvious in this one. There it is, blown up, the lateral view showing some subtle periosteal reaction. Another thing to look for is the soft tissue component. You can actually see it very well once you look for it. There it is on the lateral view. The MRI on that same lesion shows a markedly decreased T1 signal intensity with a soft tissue component extending beyond the cortex. Number 3. Here a proximal humeral lesion that is a little more subtle because it's mostly lytic. If I enlarge it, I can see the aggressive appearing periosteal reaction, and now I've circled the lesion, but I've done something wrong. I've used a thin line, which implies a narrow zone of transition, when in reality the zone of transition is quite wide in this case, suggesting that it does represent an aggressive lesion. The MRI clearly showing that the lesion extends across the physis and has this markedly heterogeneous appearance. Don't forget that metastatic disease to the lung, which is a common site for osteosarcoma, can calcify. Number 4. 11-year-old with a mixed lesion and severely aggressive periosteal reaction that is perpendicular. The MRI shows a very large soft tissue component with all that cortical disruption. On the right, you see numerous fluid levels, and when you see fluid levels, you want to consider a telangiectatic osteosarcoma. Case number 5. Here a mixed lesion in the proximal tibia, not as obvious. Here it is on the MRI where it is obvious. You can see that there's also a soft tissue component extending along the medial side of the lesion, and if you look really closely, you can see that radiographically. Case number 6. The proximal humeral lesion shows a focus of sclerosis, and if you look closely, I think I see a Codman Triangle. Here the MRI shows the extent of the lesion. Case number 7. Here a purely lytic lesion in the right superior pubic ramus that looks like a metastatic lesion to me, but turns out to be an osteosarcoma, and the MRI is showing the full extent. That is the postoperative appearance reconstruction. Case number 7. On the frontal view, slightly heterogeneous lesion, much easier to see on the lateral view, where you see aggressive periosteal reaction anteriorly and you appreciate more of a sclerotic appearance, and the MRI appearance. Number 8. An extremely aggressive lesion, extensive sclerosis, and severe periosteal reaction. Note that the next plain film very likely is post-chemotherapy because of how much more well-defined the lesion appears. The chest radiograph showing numerous round metastases. You can also see the lesion in the right shoulder on the chest radiograph. The MRI showing the extensive soft tissue component of the lesion. Notice that it goes up to and appears to spare the epiphysis. Number 9. A reminder that osteosarcoma can involve the spine. The CT showing aggressive appearance with some bone formation. On the upper right, the MRI. Note that the CT is actually very helpful to identify those sclerotic foci in the soft tissues. Case number 10. Aggressive appearing lesion in the distal femur, mostly lytic. The way it appears somewhat well defined suggests that chemotherapy was part of the treatment. Case number 11. Lot of bone formation there in the proximal femur, also shown on the MRI as being fairly dark. Note that this one does appear to respect the physis, not extending into the epiphysis. Case number 12. Distal femoral lesion with a lot of bone formation and periosteal reaction. On the MRI, you can see surrounding edema and that soft tissue component that we've seen on just about every single one of these MRIs. Number 13. A very dense sclerotic lesion in the distal femur extending into the diaphysis, and osteosarcomas can do that. Here it is on the MRI showing the extent. When I blow up the plain film, you can see a Codman Triangle, and the CT nicely confirms that. Number 14. Here a mixed lytic and sclerotic lesion in the distal femur, and you can see some smooth laminated periosteal reaction. Number 15. This is going to show you how aggressive these lesions can be. It's fairly subtle there in the proximal tibial metaphysis. You see some increased sclerosis, but pretty subtle. However, 4 months later, you can see extensive, aggressive appearing periosteal reaction and this circumferential soft tissue mass surrounding the femur on the MRI. Number 16. Another area where these can occur. Here up against the articular surface in what looks like a very aggressive giant cell tumor turns out to be an osteosarcoma. On the CT on the right you can appreciate the soft tissue extension. Number 17. Here a radiograph of both knees showing a very subtle lesion in the left distal femur, heterogeneously sclerotic lesion. After making that larger, you can see it a little better, still difficult to appreciate. On the lateral view, now we see that there is some soft tissue ossification posterior to the distal femur, and we can also see the sclerosis better. The MRI again showing the extent of the lesion extending posteriorly. Case number 18. Severely sclerotic expansile lesion in the distal radius, treated with a fibular graft. Number 19. Back to the shoulder for a mixed lesion showing some lytic component medially and some bone formation. Also note that there is a pathologic fracture, quite heterogeneously bright on the MRI with the full extent of the soft tissue extension. And the last case, Mixed, mostly sclerotic lesion, extensive, aggressive appearing periosteal reaction, mostly involving the metaphysis with extension into the diaphysis. And that's the many appearances of osteosarcoma. Hopefully now you can close your eyes and come up with more than one appearance.